How you guys doing? My name is Dr. Manasseh, also known as Dr. M. Welcome to Athletics Med. Today you're about to see me go through different sequences with patients. Also, you might see me go on the field, talk to a couple of pro athletes. Just enjoy the day. Welcome to the show. We got something really special for you. This is really what it's all about: prevention, recovery, and performance. This is the treatment room, and that's the biomechanic lab. That's why we do our kinetics. We do all our functional movement screening, and some good stuff. We got some Quincy playing at the background for right now, and I got a special guest. Say hi to Dr. B, the famous dentist here at Kodo, Rancho Margarita in South Orange County. He's about to let you know what he does and also why he's here.
So I've been struggling a little bit with some tennis elbow. I'm partly because of golf, partly because of my profession. I've been practicing dentistry here in Rancho for over 20 years, and I was recommended to Doc Manasseh to see if we can get some healing in this area. I've gone through different types of treatment, like cortisone shots, which I definitely don't recommend. It kind of only treats the symptoms. It doesn't really heal. It gives temporary relief, but right now I need someone that understands muscles and understands how to get the body healing itself. And Doc Manasseh has already done that. I've seen him about 3 or 4 times, and I'm already gaining back the strength in my elbow, and it actually was radiating up to my shoulder. So I'm excited to continue the treatment and hopefully get to a place where I'm back to 100%. So I've been seeing the doc now for maybe about 2.5, 3 weeks, and one of the things that I've noticed in his treatment is typically, I think some of our problems as weekend warriors is that we go and seek for some therapy work and we're not given the rest, we're continuing to do our activities, and so I think that's a little bit of his, it hinders his work because we're trying to make sure that, you know, that there should be some healing. But one of the nice things that I've noticed with him, as opposed to other therapists that I've gone to, is that I feel like after I am doing my activity, like I golfed yesterday, I'm not waking up as sore. So for me, in my mind, I feel like I'm getting beyond it. Now, I know if I can give a little more rest, which is what he would prefer, we'd probably see a lot faster healing. But a lot of the things that he's releasing my muscles, it's allowing me to go perform and play, but at the same time not feeling like I'm always going back to square one, where it's hurting as bad as when I first saw him. So maybe in the next couple weeks, I'm hoping to just get to 100% better and not have to worry about it anymore.
So everyone knows what we're doing. He's come really for tennis elbow, a little bit of golfer's elbow there, and then we also have the shoulder. More importantly though, we have to look at the cause. I always look at the neck, we start at the cervical spine, because at the cervical spine, everything else is controlled with the upper extremities. So what I'll do today is I'm going to release some muscles around his cervical spine. I'll address specifically his shoulder around the GH joint, or glenohumeral joint as we know it, and also do some work as far as myofascial release, or my own technique in releasing the muscle extensors and flexors of the elbow. Go ahead and start. I'm going to show you a little bit of the secret sauce, just a little bit of it. Not too much though, not too much. Go ahead and look up. Go look all the way down, all the way down, all the way down, all the way down, and then turn to your left. I'm actually on the trapezius muscle. I'm just releasing it, and then turn to your left. Any pain there, Dr. B?
Nope.
Okay, no pain with that. Most of all my techniques or soft tissue work that I do, I really call it soft tissue adaptation therapy. It's painless, although what I'm really doing is I'm addressing densification through the muscle and breaking that down. Turn to your left. Let's do the right one. Go ahead and look up. And look all the way down. Keep on looking down, keep on looking down. You're doing great. Keep on looking down. Turn to your right. what you're about to look at is I always look at functionality. So I'm looking at the shoulder length between the left and his right. He's coming in with right shoulder pain. And so what we'll do is we want to look at what good looks like versus what the condition he's dealing with right now. So again, looking at functionality. Dr. B, take your left hand all the way down, and then check out his right hand, go all the way back. So you can see that his left is lower than his right. This is the one in question. This is the one he's coming in with pain, shoulder pain. And I like doing before and after so you can see it's real. There's no editing here, it's just me. This is live. We do fingers here, Dr. B. So we're not making things up, and you get to see what I do. Here we go. Dr. B, do your left one, please. And I'll do your right one. I mean, you can see that difference, and it happened immediately. It doesn't take me a while. Within seconds, it's just knowing your anatomy, and then of course knowing how to change the soft tissue as it adapts and how to move it. And so going back to anatomy, I love anatomy. In the GH joint, you have a lot of material that lives in there. You have the bursa, you have the long head of the bicep tendon, and then you have the supraspinatus that hangs out in there. And so if you understand what hangs out in that GH joint, then you begin to address those muscles and soft tissue so that you can restore an athlete or weakened warrior's issues back to function. And that's really the game. That's really what I do best is I look at dysfunction and I treat that to return back to function. I mean, that's really what it is in a nutshell. And to me, that's what sports medicine is really all about. Taking a condition and bringing that condition back to where it needs to be. And then when we talk about professional athletes or performance, we want to know how does that translate on and off the field? Is the athlete able to do their skill at a higher speed? Are they able to perform at a higher speed? Are they able to do what they do best? And how does that translate in their particular sport or position? Let's keep on. Okay, hold on tight there, Dr. B. Just relax it. There we go. Oh yeah. Hold on tight there. Over here. Let me get this side. Just relax here. Relax it. Nice. Other side. Pull here. And last one, let's get your cross your arms. Come up. Let it go, I got you. Back. Let's get this one. Hand movement one time. Extensors, flexors. You're doing your supinators, and you're doing your pronators. Okay, those four. And everything's about the wrist. That's the secret in this exercise. If you can get that wrist to flick, all about the flick of the wrist, you'll have it right. Because that's what you guys do anyway. Yeah. Right? You're strengthening really. Mostly, I want you to strengthen more of the wrist action rather than the elbow.
So when I come in, I think a lot of the work that he does is to help release some of the muscles in those areas. And typically, like after I play golf the next day, it's really sore and stiff. And this morning I woke up, it wasn't as bad because I saw him earlier this week. But once he released a lot of these areas, just in 5 minutes, I feel like I've got so much better range of motion. It doesn't hurt. It usually rubs right here in the shoulder, which I think is what's affecting my elbow. But he works it from the neck all the way down, and it just feels like there's just so much more relief in that area. I think that's going to allow my body to heal and hopefully allow me to get back to 100%.